Okay, good evening, everyone, and thank you for joining us. On behalf of the Ontario Kinesiology Association, I'd like to welcome you to our September webinar exploring exercise guidelines for cancer survivors. My name is Jory Kettles, and I'm the Secretary Treasurer for the Ontario Kinesiology Association, and I have the pleasure of being your host and moderator this evening. All participants have been muted for the purpose of the webinar, but we have enabled the Q&A function. So throughout tonight's webinar, you're encouraged to submit your questions through the Q&A link at the bottom of your screen. We will address all of the questions at the end of the webinar. Tonight, we welcome presenters from the Exercise Oncology Lab at the University of Toronto. It is my pleasure to introduce you to our presenters tonight. Dr. Linda Trinh is an associate professor in the Faculty of Kinesiology and Physical Education at the University of Toronto. Her research is focused on the development and implementation of theoretically driven physical activity and sedentary behavior interventions for cancer control and survivorship. Alexis Whitehorn is currently working in the Exercise Oncology Lab as a PhD student at the University of Toronto. She graduated from the University of Toronto with a Master of Science in Kinesiology, and previously from the University of Illinois at Urbana-Champaign with a Bachelor of Science in Kinesiology in 2018. Golnaz Ghazanur is a research officer at the Exercise Oncology Lab at the University of Toronto. She graduated from the University of Toronto with a Master of Science and a bachelor's degree in Kinesiology and Physical Education. And Monica Atunis is a registered kinesiologist at the Exercise Oncology Lab at the University of Toronto. She's a graduate of the Masters of Professional Kinesiology program at the University of Toronto and earned her Bachelor of Science in Kinesiology at Health Sciences at York University. So welcome to our presenters, and I will turn it over to Dr. Trinh to kick us off.
Great, thanks so much, Jory. Thanks everyone for joining this evening or this afternoon to learn more about the exercise guidelines for cancer survivors. I'm joined today by a fantastic team of trainers and registered kinesiologists who will guide you through some of the exercise training and prescription principles that you need to know when working with cancer survivors. So our session overview today is I'm going to talk about the exercise guidelines. What are they? The benefits of exercise for cancer survivors, some of the common barriers to exercise participation. Then we'll go through some screening and physical fitness testing that are required before starting to work with cancer survivors. And then we'll talk about some of the common cancer types, side effects, and recommendations when working with the different cancer types. And then we'll go into some practical recommendations when you're prescribing exercise to cancer survivors. And then we'll have some resources for you at the end if you want more information. And then we'll outline a few of our research trials that we have going on in case you want to send participants our way after they finish working with you. And then we'll have a Q&A. So I just wanted to open up with the current landscape of cancer in Canada. So we know cancer is the #1 leading cause of death in Canada. 2 in 5 Canadians will develop cancer in their lifetime. And every year we have over 200,000 new cases of cancer. The survival rate of cancer has been growing due to increased screening and treatment methods. So the 5-year cancer survival rate is about 64%. These are the most commonly diagnosed cancers in Canada for males and females. So males, it's prostate, females, it's breast, followed by lung and colorectal. So those are the top 3 cancers. And like I said, the better screening and treatment methods have led to a growing number of cancer survivors alive today in Canada who will have very unique supportive care needs that need to be addressed. So many of you are aware of the Canadian public health guidelines for the general population, but we now have specific exercise guidelines for cancer survivors. So this was an update from the 2010 ACSM, or the American College of Sports Medicine guidelines that were site specific, so it was based on cancer type. So now we have these updated 2019 exercise guidelines from the American College of Sports Medicine, where exercise is considered one essential component of supportive cancer care. So the goals of the exercise guidelines is to create an exercise prescription to help patients cope with treatment-related side effects and lower the risk of developing certain cancers. So the guidelines came in 3 sets of papers, research papers that were published in 2019. The first paper was to evaluate and summarize the evidence for the role of exercise for reducing the risk of cancer and for improving survival after a diagnosis of cancer. The second paper here is the consensus guidelines or the exercise guidelines around what the fit prescriptions are for each of the different symptoms that cancer survivors may face. And then the third paper is focused on how do we translate this evidence into clinical and community settings. So how do we get clinicians to refer their patients to exercise resources, and how do we get them to refer them to qualified exercise professionals to develop an exercise program for them. Some of you may be familiar with the old guidelines. So these were the previous 2010 exercise guidelines. They look a little bit different here. So you can see here, these were the ACSM guidelines, and many of the recommendations at that time were to follow the general public health guidelines for the general population. So 150 minutes of moderate to vigorous physical activity. So the new guidelines are a departure from these exercise guidelines because we now have very specific fit prescriptions for some of the symptoms that cancer survivors may face. And the new guidelines that I'll show you in just a couple of slides are more symptom based, so they're symptom guided, whereas these old guidelines, as you can see, they were site specific. So you can see that they're focused on breast, prostate, colon, and so forth. So the new guidelines is a departure from this model. So we now have very good evidence that exercise is good for cancer prevention. So it lowers the risk of the 7 common types of cancer, including breast, endometrial, kidney, bladder, esophageal, stomach, and colon cancer. So we have very strong evidence to suggest that exercise can now reduce the risk of developing these 7 types of common cancer. When you're working with cancer survivors, they will experience many acute, long-term, and late effects from cancer and its treatment. These are a number of different side effects that you will encounter, including anxiety, bone health, cognitive function, depressive symptoms, cancer-related fatigue, poor quality of life, lymphedema, nausea, sexual functioning, physical functioning. So there's a lot of these side effects that exercise can help with alleviating. So these are the most common side effects that you'll see. And here are the benefits of exercise based on the current guidelines for people during and following cancer treatment. So the recommendation is that as soon as a cancer survivor is diagnosed with cancer, they should be exercising as soon as they've been diagnosed. If they're, it's obvious that it's important to exercise before a cancer diagnosis, but if once they're diagnosed, you should begin a exercise program immediately. So you can see that there is now strong evidence that exercise can help with cancer-related fatigue, health-related quality of life, physical function, anxiety, depression, sleep, lymphedema, and bone health. For bone health and sleep, there's moderate evidence showing that exercise is beneficial. And you'll probably notice that on the screen, you're not seeing some of the other side effects like cognitive functioning or neuropathy. That's because we don't have sufficient evidence for that particular outcome to recommend a fit prescription. So that's a obvious knowledge gap that the research community must fill. But that does insufficient evidence for that specific cancer outcome doesn't mean that cancer survivors won't benefit from engaging in exercise. So they should still be encouraged to continue exercising. So these are what the current guidelines look like. So I know it's a little bit busy in this slide, but these are the recommendations. So when you're working with cancer survivors, you can see that it is now symptom guided. So depending on the goals of the cancer survivor, And depending on the symptoms that they have, you will be prescribing either an aerobic training program, a resistance training, or a combination of both. So you can do either aerobic or resistance or a combination of them. So the general guidelines suggest that the exercise guidelines for cancer survivors suggest that you should exercise 3 times a week for 30 minutes for a total of 90 minutes of moderate to vigorous physical activity per week, plus 2 days of strength training for the clinical benefits. Cancer survivors should still be encouraged to reach the 150 minutes of moderate physical activity for overall health and to avoid inactivity and exercise to their abilities and what they can tolerate. But it is now symptom guided, so you should let the symptoms guide what sort of fit prescription you should provide. And this provides you a really great overview of what each of the what the dose is that you need. So for example, cancer-related fatigue will affect over 70% of individuals who have cancer. So cancer-related fatigue is very different than the fatigue that you and I face every day. So it's fatigue that's not alleviated by rest. So it's fatigue that is from their treatment. And if you're working with a cancer survivor who has a lot of fatigue, the recommendation is to do 3 times a week, 30 minutes per session of moderate intensity physical activity and 2 days a week of strength training, or you can do a combination of that. So those are the general guidelines. And you can see where there's moderate evidence for bone health and sleep because we don't have we have insufficient evidence for that. So we don't have a very specific dose or specific fit prescription for these 2 symptoms. And for other symptoms that you don't see on the list, it does not mean that exercise isn't beneficial. You can still prescribe them an exercise program. I would get them to follow the 150 minutes guidelines for the other types that you're not seeing on here. I also want to note that it's important to also know how many cancer survivors are currently active now. So this is a accelerometer graph. So an accelerometer is a device that it's a research grade device that you wear around your waist to track physical activity patterns. And you can see here at the very top are men and women from the general population without cancer. And then at the very bottom are the prostate and breast cancer survivors. And you can see that breast and prostate cancer survivors spend more time engaged in sitting time. So that large chunk of that black pie chart that you see, 68.5 and 68% in sedentary pursuits. And you can see that they spend about 1% or 0.5% in moderate to vigorous physical activity. So depending on the research that you're reading, depending if it's self-reported physical activity or if it's device-based physical activity measures, if we're going with device-based measures, about 8% of cancer survivors are currently meeting physical activity guidelines. So that's a very, very low percentage. And then if you're looking at self-reported physical activity, that number can vary from 17 to 58%. So that's a big range, but what is important to know is that the majority of cancer survivors are not meeting physical activity guidelines to accrue these clinical benefits that I've just mentioned. Some of the most common barriers that you'll encounter when working with cancer survivors are these top 3. One is I have no time. And I have medical problems or health issues, and I'm too tired, mostly from cancer-related fatigue. And here are some tips that when you're working with them, especially if they have no time, some of the things is that you can schedule exercise as a part of an appointment or in their agendas, using exercise as a form of transportation. You can use action planning, helping them plan where, what, when, and how they're going to do their physical activity. If they have medical issues or other health issues, I would recommend that they exercise at a level that's tolerated and progress gradually. Exercise with a qualified exercise professional under supervision, and then go through any screening or physical fitness testing and modifications that are needed. If they're too tired, one of the things is that they can, there's usually a pattern, so you can find out on days when they're least fatigued and they can exercise there. They can reduce the intensity and duration, but avoid inactivity. So what you don't want is someone who's just completely not doing physical activity. They can do light physical activity if they can't achieve moderate to vigorous physical activity, but the goal is to avoid inactivity. And finally, they can accumulate exercise in any amount throughout the day. So I did say 3 times a week, 30 minutes for 90 minutes of moderate to vigorous physical activity per week, but they can accumulate as many bouts as possible throughout the day. So if they can only do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening, that's still 30 minutes a day. So you can accumulate in sort of any increments for that. So now I will turn it over to Alexis, and she will discuss the screening and health evaluations when working with this population. I'll turn it over to you.
Thank you so much for the introduction, and thank you all for joining. So to kind of go a little bit into more detail, I'm going to talk about the screening. So typically before beginning any physical activity program, it's expected to employ a client pre-screening for physical activity. A common pre-screening tool that we use in research is a PAR-Q, or Physical Activity Readiness Questionnaire for everyone. The PAR-Q is used to identify any medical conditions that may interfere with safely performing exercise. There are generally 7 questions that are asked to identify the health status of the participant. For example, a question may ask if the client has ever experienced any heart condition or chest pain, amongst many other questions regarding health. If the participant does select yes to any of the general questions, they are to answer additional follow-up questions, and they just go a little bit more into detail regarding their health history. If the client selects yes to any of the follow-up questions, a medical clearance will be needed from their physician in order to continue exercise. But the overall purpose of administering the PAR-Q is to assess if it is safe for new participants to actually participate in any physical activity, especially when starting a new program. So after you do the PAR-Q, or the PAR-Q has actually been assessed, there are additional health evaluation screens that should be taken. In accordance with American College of Sports Medicine, it is recommended that we do take a resting measurement, and this would include things such as the blood pressure and heart rate, followed by body composition. So this will include things such as your height, weight, and BMI, circumferences of the hip and waist, and skin fold measurements are also useful too in measuring body composition, but it does require a little bit more skill and trained professionals to accurately deliver some of these measurements. And the densitometry is useful in measuring body composition, but again, there is more complex equipment such as the DEXA or the dual energy X-ray absorptiometry. And these are more standard tools in practice, but we recognize there are many barriers such as the cost and the trained professionals that are needed to deliver these tests. However, again, before starting any physical activity program, most only require simple tests, and these are just, again, resting measurements and simple body composition that includes BMI and waist to hip circumferences. So before designing a physical activity program, it is very important to assess the participant's health-related physical fitness. And the test usually will be composed of cardiorespiratory fitness, muscular fitness, and flexibility. Cardiorespiratory fitness will include either a VO2 max test or a submax test. Muscular fitness will assess strength and endurance, and flexibility just assesses the ability to move a joint through its complete range of motion. The reason for using a maximum or a sub-maximum test, it really just depends on the reason of the test, also the risk level of the participant, and the availability of appropriate equipment and personnel. Maximum tests usually require participants to exercise to a point of fatigue, which may not always be appropriate for some individuals who require need for emergency equipment. Sub-max tests are typically used because maximum exercise testing is not always feasible in the health fitness setting. So the basic aim for a sub-max test is to determine the heart rate for a sub-max test, or the response to one or more sub-maximum work rates, and use the results to predict the VO2 max. So in research, we typically use graded exercise tests to determine the VO2 max test. And the different modes of testing may include field tests such as walking and running, motor-driven treadmills, or mechanically brake cycle ergometers. And lastly, a step test can also be used to measure cardiorespiratory fitness. It's typically a little bit inexpensive and requires little to no equipment. Muscular fitness is also important to assess, and this again just measures strength, endurance, and power. Muscular strength is the muscle's ability to exert a maximum force onto one occasion, versus muscular endurance is the muscle's ability to continue to perform successive exertion or repetitions against a submaximum load. And muscular power is just the overall muscle's ability to exert force per unit of time. So when we are typically administering these muscular fitness tests, they're done in person, and we usually use a 1 rep max test or a multiple repetition max test or push-up tests. Another great standardized tool that is commonly used in research to assess functional fitness is the senior fitness test. So the senior fitness test is mainly used for older adults, but it can be used for clinical populations such as cancer. A limitation of many of the standardized tests mentioned earlier requires trained personnel, it utilizes more expensive equipment, it's overall more costly and required to be administered in person. However, what's great about the senior fitness test is although a trained staff is required to administer this test, it can be administered at home, reducing some barriers for those participants. So the senior fitness test does measure lower body strength by using a 30-second chair stand, upper body strength with using a 30-second arm curl, aerobic endurance, and this is using a 6-minute walk test or a 2-minute step test. You can measure lower body flexibility with the chair sit and reach, upper body flexibility with the back scratch, and lastly, agility and balance with using an 8-foot up and go. So telehealth or virtual training or counseling is becoming more and more common practice where more physical activities are being performed home-based. And the Canadian Society for Exercise Physiology actually issued a telehealth training and counseling guidelines for physical activity to be remotely delivered. Similar to in-person programs, some of these assessments still remain the same with adjustments made to accommodate to safely perform physical activity at home. So again, we still have to do that pre-screening, which is expected for physical activity, regardless whether you are training remotely or in person. The pre-screening will include assessing the PAR-Q and then taking heart rate and blood pressure, which you actually can do from home. And then next is safety. So safety just includes taking any measurements as it is reasonable to ensure the safety of your participant and is appropriate depending on their treatment or training plan. So these might be questions such as, are they exercising indoors or outdoors? Is the space clear of obstacles, any slips, trips, or hazards? This also can include children. So are there any children that may be in danger of getting hurt from well-intended participation? Does the participant have someone that is home or nearby that they can signal if they were to get hurt? Other questions is, have you actually established a level of tolerance scale with your participant? So how will you know if they're actually in pain or overexerted themselves? And we use a rating of perceived exertion scale to kind of determine this. And then do you have a emergency contact or a phone number or other method of contact if the connection were to fail? And then lastly is privacy. If you are training at home, is the training sessions being recorded? And how would these recordings actually be stored? And then lastly is documentation. So similar to how you would document an in-person session with your participant, you want to make sure you, again, document or maintain the progress reports, any charts, intakes, or status update forms. And then in addition to documentation, because you are delivering a lot of this at home, functional fitness tests can actually be administered at home. And the three commonly used remote delivered tests are the step test, 6-minute walk test, and sit to stand. But again, however, when you are administering these tests, making sure that you document all of the test scores and any additional items and tests when you are delivering all of these tests remotely.
So as mentioned before, in Canada, breast cancer is the #1 cancer diagnosed in women. However, with improvements in early detection and treatment protocols, the relative 5-year survival rate is around 88%. Surgery is the most common treatment, which can include a lumpectomy, which is the removal of a breast lump with a minimal margin of normal tissue around it, as well as a radical mastectomy, which removes the entire breast and some of the axillary lymph nodes that are involved. Surgery is often combined with adjuvant treatment for early stages, which is the additional treatment that is given after primary treatment to lower the risk of recurrence. Or for later stages, they may have neoadjuvant treatments or therapy, which is usually radiation or chemotherapy, given as a first step to shrink a tumor before the main treatment. Many cancer patients also receive hormone therapy, either tamoxifen or aromatase inhibitors for 1 to 5 years. There are different side effects associated with different types of treatments. For example, lymphedema is a common and chronic side effect after surgery and radiations, where lymph nodes are involved. It is described as ongoing swelling, usually in the arm or breast area, which is caused by buildup of lymph fluid due to damage to the lymphatic system in that area. Lymphedema may cause limitations in range of motion, swelling, so it's important to monitor that and also use compression garments when resistance training. Other limitations with surgery and reconstructions are weakness in the muscles of back, shoulder, arms, abdomens, like the rectus abdominis is commonly involved. So it's really important to avoid moderate to vigorous intensity exercise for abdominal strength for at least up to like 8 weeks post-surgery. Hormone therapy is also associated with increased risk of fracture, joint pain, stiffness, and osteoporosis, so high impact exercises should be avoided. Next slide, please. Thank you. And prostate cancer is the most common cancer among Canadian men. Risk is higher for men over the age of 50 and just increases with age. The 5-year survivor rate for prostate cancer ranges from over 90% for early stages to around like 31-32% for advanced stage 4 cases. Due to early diagnosis of most cases, active surveillance may be an option if the cancer is confined and slow growing. So they usually follow PSA or prostate-specific antigen levels in the blood. Otherwise, most early stage disease can be treated with surgery, which is commonly a radical prostatectomy, and radiation is also another common treatment. The side effects associated with prostatectomy and radiation are usually urinary incontinence, lymphedema in legs and or genitals, as well as fatigue. So it's important to avoid heavy lifting and watch for abdominal strain for 6 to 8 weeks post-surgery. Pelvic floor or Kegel exercises may also be beneficial for pelvic health and for incontinence. And we just want to make sure that they are comfortable when exercising. So we can recommend them to empty bladder before training, use the washroom, and also avoid some seated exercises, which may be uncomfortable for them. A lot of prostate cancer patients also undergo androgen deprivation therapy. And side effects may include experiencing hot flashes, osteoporosis, decreased muscle mass and strength, as well as weight gain, anemia, and limitations in balance. So for older participants and those who have osteoporosis, risk of fall, and risk of fracture, it's important to obtain medical clearance. And weight bearing and resistance exercises may actually be helpful for them to counter bone loss. But we want to make sure that we are avoiding contact sport and also follow a gradual training progression. Lung cancer is another common cancer, and it's the leading cause of cancer-related death. So about 23% worldwide and 13% of new cases. However, unfortunately, over half of all lung cancers are diagnosed after the cancer has already metastasized. As such, the 5-year survival rate is generally very poor, about 50% for early stage disease. Treatment usually involves a combination of surgery, radiation, chemotherapy, and potentially targeted therapy as well. Common side effects for surgery includes pain, spreading from the ribs, as well as risk of infection, bleeding, and pneumonia. And radiation, common side effects for that include nausea, fatigue, lung scarring, and reduced lung capacity. And for all lung cancer patients, it's important to test their lung capacity and aerobic fitness, and also watch for shortness of breath and only exercise as tolerated by their lung capacity. For chemotherapy, common side effects are fatigue, neuropathy, peripheral edema, as well as high risk of infection and fluid buildup in the lungs with some agents. So it's important to be mindful of neuropathy using free weights because it can affect their grip as well as their balance. Targeted therapy for lung cancer, there is a risk of bleeding, blood clot, and high blood pressure. So for that, it's important to be mindful and avoid contact sports or any exercise with risk of injury and bleeding. Colorectal cancer is another one of the common cancers, about 10% of the new cases in Canada. Surgery is the most common treatment for all stages, and it could be a polypectomy, which they usually do it when they're doing a colonoscopy, followed by like a colectomy, a colostomy, or a bowel resection. It might also be followed by chemotherapy and radiation if the cancer has spread. So for surgery, similar to other cancer types that was mentioned, it's associated with pain, bleeding, clots, risk of infection, and for colorectal cancer, possible stoma, depending on the treatment type. It's important to avoid strenuous activity, abdominal strain 6 to 8 weeks post-surgery, and also monitor their stoma for risk of herniation. For radiation, we have to be mindful of their fatigue levels, if they experience any nausea, bowel incontinence, bladder irritation, and irregularities. See that exercises may be uncomfortable for them. And also for chemotherapy, same as other cancer types that was mentioned, we have to be mindful of if they were experiencing neuropathy, fatigue, hand and foot symptoms, issues with balance. And also for this cancer specifically, we need to be monitoring their chest pain, shortness of breath, as well as sign of dehydration, encouraging them to take extra fluid when exercising. So finally, I just want to highly emphasize that for exercise prescription, we should mainly focus on the side effects individuals are experiencing from different treatments, as well as their individual abilities and physical function rather than the tumor or the cancer type. So now I will pass it off to Monica for more exercise prescription and practice recommendations.
Thank you. So when it comes to exercise recommendations for individuals that have previously had cancer, it's really important to ensure that you know how to modify exercise in order to meet someone's current capabilities and that you ensure that you're progressing exercise slowly. So in my experience, the individuals that I work with tend to be quite eager to incorporate physical activity into their daily routine, as many are aware of the benefits associated with regular physical activity and want to improve their overall quality of life and gain a larger sense of independence. So, after receiving cancer treatments, surgeries, or medications, it's extremely common to experience side effects, like Golna has mentioned. And some of these include fatigue, neuropathy, lymphedema, discomfort, sarcopenia, and range of motion limitations. So, these are some of the most common side effects that I have personally witnessed in practice. And it's important to understand how these side effects will influence the individual, and it's crucial to be aware of possible next steps that can be implemented to ensure that exercise is made to be as comfortable as possible. So, for example, if you have somebody that experiences fatigue, perhaps we're adjusting the work to recovery ratio and implementing more frequent breaks. Whereas, let's say someone is experiencing foot neuropathy, perhaps we're incorporating a tool to help with balance and or incorporating a gentle stretching routine for the affected area. In addition, incorporating various types of exercise such as aerobic, resistance training, and balance will help individuals meet those cancer-specific guidelines or general guidelines that were mentioned previously by Linda. And it's important to note that exercise should be done at an intensity that is comfortable for the individual. So, for example, if one were to do aerobic activity, you could administer the talk test to determine the exertion that someone is currently working at and whether or not it is suitable for the person. You could also use the rating of perceived exertion scale, or RPE, which is a little bit more subjective, but it's still good to determine the intensity that someone is performing aerobic or resistance training. Next slide, please. And so one of the ultimate goals that us as kinesiologists have is to teach the individuals that we're working with how to move in a safe manner. Thus, the importance of beginning small and slowly progressing over time, as this will allow enough time for learning, the building of self-efficacy, as well as to improve motivation long term. So in terms of modifications for exercises, they can look like a variety of different options. So you could have alternate variations of certain exercises. So for example, if someone had difficulty with a forward lunge, which is an exercise that requires the front knee to absorb quite a bit of impact, then a good alternative would be a reverse lunge, as you're removing a lot of the impact by taking a step backward instead of forward. Another avenue you could take would be to decrease the range of motion that you were asking someone to complete. So this can be done for many exercises such as a squat, shoulder press, a lunge, etc. And this relates back to ensuring that you're starting small and progressing slowly so that the individual has time to adapt to the smaller range of motion stimulus that we've just introduced. Thirdly, modifying angles and biomechanics of certain exercises can also help. So in a hypothetical situation, imagine that you've given a patient, participant, client, it really depends on the environment in terms of how you're referring to this individual. But let's say you've given someone a chair sit up where you ask them to lean backward and then sit upright. But let's say they end up leaning forward and performing a little bit of a crunch instead, and they present with some hip pain as they perform the exercise. Firstly, you would assess the movement and ask how the movement would feel if you were to decrease the range of motion. And then from there, another step could be to remove the lumbar flexion entirely if you find that the pain becomes exacerbated, especially during that crunching motion or that forward lean. And so you're just essentially having them complete the chair sit up in a little bit of a modified version. So just leaning back and then sitting up nice and tall. You may also find some success in this hypothetical situation by teaching proper core bracing techniques during this movement pattern. And lastly, introducing tempo is another great way to modify exercise. So let's also imagine that someone is in between resistance bands or weights, and there's no in-between level, but let's say they find level 1 to be too easy and level 2 to be too challenging. In this situation, utilizing tempo is a possibility, one that I personally really enjoy, as it will make the exercise more challenging by increasing the time under tension that someone is spending on a given exercise, which will in turn increase muscle fiber recruitment and lead to improvements in strength. So if you're looking for a nice middle ground, I would go with the level 1 or the lighter weight and then add a few seconds of tempo work if you really wanted to make an easier transition between level 1 and level 2. Next slide, please. And then within practice, you will notice that different types of cancer, surgeries, and medications may result in some nuances within exercise. So for example, individuals that have had a lymphodectomy, especially in the forearm, so it's the removal of lymph nodes, tend to find push-ups to be slightly uncomfortable or experience feelings of tightness, especially in the forearm. Well, it's wherever they had the lymph nodes removed. So in this case, it would be the forearm. And to help alleviate this discomfort, you may find that stretching the flexor and extensor muscles in the forearm and also stretching the wrist to provide some relief. And in addition, you may also find that using elevated handles for push-ups to be beneficial for some individuals as it reduces the stress placed on the wrist. All in all, having a good understanding of how contraindications may impact health and one's physical activity is necessary within the profession. When it comes to blood pressure, understanding the physiology behind breathing techniques is important, as there is a lot of scenarios when you wouldn't want someone to hold their breath during exercise, which would be called the Valsalva maneuver. Some examples include those with high blood pressure or concussed individuals, as you would not want these people to be holding their breath or one's breath because it will increase intra-abdominal or intracranial pressures, possibly resulting in unfavorable adverse events. And lastly, physical literacy and education also plays a large role in our practice. And this is because once someone has gone through the process of various cancer treatments and medications, they may feel cautious when returning or beginning physical activity, as they want to avoid injury and don't want to worsen their health status. Thus, it's really important that we spend some time educating patients or participants on why we're having them perform a particular exercise, the differences between different exercises, so let's say a squat and a deadlift, as well as answering any common questions that they may pose. So a very common question that I get asked quite often is, why are my joints cracking? So crepitations, and typically, unless the individual is presenting with any pain in addition to the crepitations, so if they are presenting with pain and crepitations, you would refer them out, but for the most part, if there's no pain with the crepitations, you can have them monitor it if it's something to be, if it is something that they are typically concerned with, but they should be okay. And next slide, please. And so as we near the end of our presentation, here are some absolute indicators of when to stop physical activity. So a significant drop of blood pressure values greater than 10 millimeters of mercury, an oxygen saturation level of less than 88%, moderate to severe angina, signs related to syncope such as ataxia, dizziness, or confusion, volitional fatigue or exhaustion, shortness of breath, poor perfusion, and pulmonary edema. Over to you, Linda.
Right. So just to summarize what we've talked about today, physical activity is safe and tolerable for most cancer survivors, even during treatment. So like I mentioned before, as soon as a cancer survivor is diagnosed, it is beneficial for them to start an exercise program immediately, even during treatment, and continue after treatment. Cancer survivors should aim for at least 90 minutes of moderate intensity physical activity per week and 2 days of strength training. You want to avoid inactivity and exercise to their abilities as much as they can tolerate. And exercise needs to be tailored and be modified depending on where the cancer survivor is at. So you want to meet them where they are. So if they're deconditioned, you need to modify your exercises for that. Compared to someone who is symptom limited. So for those individuals who are symptom limited, they can follow the general public health guidelines for the general population of 150 minutes of moderate physical activity. But if they have symptoms that they're experiencing, then those guidelines, exercise-specific guidelines and fit principles come in handy. So it depends on the cancer patient that you're seeing. Some can be further along their treatment, or they can be they've had their cancer a long time ago, and they're now in the survivorship period. And then obviously last thing is to monitor for any sort of indications to stop exercise and any changes in health status. I know we've gone through a lot of information today. So if you need additional resources, I've provided some resources here. They're really excellent resources to help you with your practice. So for those of you who you're interested in further certifications, if you want to get a cancer-specific certification, you can look at Thrive Cancer and Exercise Training. They're out of University of Calgary, and they provide you with cancer-specific resources to work with cancer survivors. And you can also get a certification through there. Society of Behavioral Medicine has a wonderful resources dedicated to physical activity. So there's one on how to do physical activity at home, especially with older adults. And then the University of British Columbia has a number of excellent exercise resources for qualified health professionals and qualified exercise professionals, as well as the ACSM website, which is where the cancer and exercise guidelines are housed. And then finally, if you're working with individuals who have bone metastasis, UBC has a great resource on how to, a whole sort of toolkit on how to work with individuals with bone metastasis. I do want to draw your attention to two exercise studies that we do have going on in our lab here. So if you're working with a cancer survivor and they are looking for additional resources, you can send them to the University of Toronto for an exercise study where we're looking for individuals who are early stage, completed treatment within 5 years, not meeting physical activity guidelines, early stage cancer survivors, and then we'll take them through a remotely delivered exercise program for 6 months. So that's if they're done working with you or if they need additional resources. These are exercise studies, so we're trying to answer a research question. This one in particular is answering the question on whether or not we can get cancer survivors to maintain physical activity after a remotely delivered exercise program plus behavioral counseling. So this is our phone number here. If you have a cancer survivor who does not meet any of these the criteria, they're metastatic, or if they're living in rural areas specifically, and they're further along in their treatment, or they're even meeting exercise guidelines, you can refer them to Excel. So this program is run out of the University of Calgary, and it's a 8 to 12 week free exercise program. So both these programs are free, no cost to the individual, and they can attend exercise classes remotely twice a week. So these are the two exercise programs we have available. If you have any questions from today, if we don't answer everything, or if you just had you want more information, feel free to contact us. Here is our email and our phone number. Feel free to reach out to us, and we'll answer any questions that you have. So that concludes our presentation. So I'll turn it back over to Jory.
All right, that was great. Thank you guys so much. Lots of really great information to share for sure. So just a reminder that the Q&A function is available. So we got a couple of questions here that we'll go through, but certainly lots of time for additional questions to be added. So the first question that we have, going back to one of your early slides, after determining the fit prescription based on the symptom, how do you decide between aerobic resistance or a combination prescription? Is that patient directed? So I think that's going back to the one of the early slides with the fit principle.
Yeah, I can kind of take over this question. So, in terms of after doing the assessment, it really just depends on one, if it's research based. Some research questions are specifically catered towards aerobic or their resistance training or combination. But if you're just taking on a regular cancer survivor as a client, it really depends on what the actual goal of the patient is. So if the patient is actually looking to become stronger or just improve their cardio in general, the overall physical activity guidelines for Canada specifically says that you need to incorporate both combination of resistance and aerobic training. So you do want to try to target both. And again, kind of going back to Linda's slides from earlier, different cancer types and different prescriptions are associated with certain outcomes, whether that's better, I guess, like symptom management, overall physical functioning, strength, sleep, different symptoms is just basically um, associated, I guess, with either combination or aerobic or resistance. So it really just overall depends on what the patient is looking for in general when it comes to exercise.
I can also speak that in many of our research trials, we do a combination. So we do both aerobic and resistance training. And of course, you have to tailor those exercises according to the individual. So depending on the symptoms that they have, whether or not they're deconditioned, you do have to modify the aerobic and resistance training portion. But I think, again, it depends on the goals of your client. As well, or as the cancer survivor. I don't know if Gonaz and Monica, do you have anything else to add to that based on what you're seeing?
All good on my end. So, Golnaz, did you want to add anything?
I think it was covered.
Okay, great. So next question, specific to lung cancer patients or lung cancer survivors. Clients who have had lung cancer and or lobe removals, are they able to stay above that 88% oxygen saturation noted in the contraindications?
Yeah, so really good question. Oh yeah, sorry, I don't know if that was audio from my background or if someone else wanted to say anything, but I can begin. So that's a good question, and even someone that hasn't had lung cancer, they may find themselves dropping below that 88% O2 saturation level. And when that does happen, it's just really important that the healthcare professionals that are on the floor are aware of it so that maybe they are either staying with the participant as they do their exercise, just in case something were to escalate, just so that they can be ready to, again, escalate the situation if need be. And sometimes if a patient does have lung cancer, they may not be able to achieve that threshold of above 88%. But it's really important that if they're not able to, that again, that's a moment where you stop, you try to figure out a plan with your healthcare team, just in case that did escalate. So hopefully I answered that question quite satisfactory. But do let me know if you do have any more. And if anyone wants to tag along, please do.
I can just add on saying that it is possible and common for them to have high oxygen saturation, even above 90%. For those that do have that as a concern, there's treatments for that. So they can be like supplemental oxygen therapy to improve that. So it's just more so monitoring that and making sure that it is under control and obtaining physician's clearance if needed.
With those particular patients, do you typically have them wear an oxygen saturation monitor while they're exercising, or sort of go by patient symptom and patient presentation before putting a monitor on?
Good question as well. So it's more so up to the patient and their physician in terms of what they've deemed to be safest for the patient. If a oxygen tank is something that they find alleviates a lot of their symptoms and they feel more comfortable with, then I think that's a great idea to have it as they do exercise as well. But I think from our lab experience or our study experience, we haven't had somebody exercise with oxygen yet. But if it is something that they are more comfortable to do so in, then I think that's a lovely idea.
Okay, there's a question here. Are there specific recommendations in terms of infection control for this population, given that they may be immunocompromised or medically vulnerable, and we are in an ongoing pandemic? Remote delivery was addressed, which is great. There's also currently a draft standard from the Canadian Standards Association, or CSA, proposing universal respirator use in healthcare settings. And this is coming from a long COVID researcher. Kind of a loaded question, but I guess just considering the immunocompromised state of some of these patients, are there specific recommendations for infection control?
So I can begin with that one. So I think depending on the comfort of the patient, most of our trials are done remotely, so they're doing it in the comfort of their own home. So depending on the patient and sort of what they're comfortable with, I think that if you can do remote delivery of exercise programming, that can certainly help with you know them with the travel barriers, at least coming to a facility where it's group based. But also, having cleaning procedures in place if they are coming in person, that you do sort of, after using every equipment, that there are proper cleaning procedures that go with that after each one, after every session. So I'm going to turn over to the trainers to see if they have anything to add for that.
I can also add on from what I know, the procedures are exactly the same as what we used to do during the pandemic in 2020, 2021. So sanitization, exercising in outdoor spaces or leaving like doors, windows open for proper ventilation. If they are able to and they're comfortable wearing a mask, like we see that a lot as well. And again, just if possible, exercising remotely or exercising like making sure that they are keeping their like physical distancing from others or exercising privately one-on-one with a trainer would be an option as well.
Okay, next question. Any recommendations around taking blood pressure measurements on the upper limb with lymphedema?
I can kind of start this question off. So I know with remote delivery, the telehealth, they talked about we still need to kind of take the resting measurements such as blood pressure and heart rate. There are different ways to actually maintain blood pressure. So you can actually use a blood pressure cuff. And they have different ways that you can actually wear the blood pressure cuff, or sometimes in those specific cases, if they went to visit their doctor, we usually just ask them what was their last doctor visit, and then what was the blood pressure that was given from your doctor. So their doctor should be able to essentially administer it properly, given that they had their lymph nodes removed and they had those limitations with taking their blood pressure. So that's another way.
Usually, like it's common that for lymphedema to be, if they're, for example, breast cancer patient, that only one side is affected. So it's always an option of using the other arm. I believe also like the manual method, like using not the automatic versions, but using a manual stethoscope and cuff instead of the automatic ones is also helpful. I haven't seen this in practice, but I believe there's also an option of getting the blood pressure from the leg, like while the patient or the client is lying down. but I haven't personally seen that one in practice.
Okay. The ACSM updated ACSM guidelines for exercise testing and prescription handbook is the information that you shared in the 2019 update. This individual has a copy from 2019 and would like to know if they should be picking up a new copy.
So is it the guide, is it the exercise testing textbook? I assume that that one has been released. It should, I think it's, I can't remember what that I know there's an exercise testing textbook, but if it has the updated guidelines in there, then you don't need to pick up another. I don't think another one is out. I think you have the latest copy. So I would recommend that you go to the ACSM website, so the resource I provided you. They have the most up-to-date exercise guidelines, including that infographic that I showed you with the fit prescription. So depending on the textbook that you have, I have an older one that doesn't have the updated guidelines in there. So if you don't see that fit prescription for the symptoms that I refer to, then you know that that one is an older textbook. So you probably have to go and download the infographic from ACSM's website, main website.
Okay, great. And the last question, kind of a loaded one here. What activity or fitness resources are being provided by the hospitals? What's the role of private clinics and training facilities in the spectrum of care? How do we convince people that kinesiologists are qualified and appropriate to assist cancer patients?
Yeah, that's a challenging one. I think it really depends on the province and it depends on the hospital. So I know that we are very fortunate, at least in Toronto, where we're based, that we have Princess Margaret Cancer Center, where there is there's an Elixir, the wellness and survivorship clinic there, where they have kinesiologists embedded in their healthcare team. And they have exercise programming available. The other one is out of Sunnybrook Odette Cancer Center. They have a Wellspring on site, again, where they have kinesiologists on site working with cancer survivors at a low, providing them with exercise program at low cost or are free. And I think that clinicians who are champions for physical activity, who are aware of the exercise guidelines, will be referring patients to them. And I think that the awareness comes from the hospitals actually having an exercise clinic embedded in there, or their clinicians are actually really passionate about sort of advocating for exercise. So it really depends on the awareness. And it's a challenging question because we're still trying to figure out how we get clinicians to assess, advise, and refer patients to exercise programming and to qualified exercise professionals. So this is something that we're struggling with as researchers. The evidence is there. We have exercise guidelines. How do we get clinicians to take the next step and refer their patients to a kinesiologist? Anyone else want to jump in and say anything from what they've seen?
I'll just add on and say that it is still like an ongoing, I guess, battle, if you will, like to try to get healthcare professionals to utilize registered kinesiologists. So it's a little challenging, but Golnaz, I believe you also wanted to add on to that.
Yeah, I just wanted to say that there is a lot of resources out there. So if the kinesiologists they feel they themselves feel comfortable working with patients that are undergoing treatment, as well as like recent survivors, that can be a factor. So there's a lot of good resources out there. You can get additional certifications or sign up for different webinars that are even free of cost. So just having those certifications and qualifications can be helpful for physicians and for patients as well to have more trust in the registered kinesiologist.
Yeah, that's great. And I think it does speak to sort of a larger issue, Monica, as you highlighted, where partnerships with other health professionals and kinesiologists, and sort of trying to get kinesiologists recognized across the healthcare system is an ongoing challenge, and something that the OKA is working strongly to try and address. So it is 8:02. With that, once again, I thank you all for attending, and to our presenters, thank you so much for sharing your expertise with us tonight. There were some requests to go back and show the absolute contraindications slide. What I will suggest instead is that in about 2 weeks' time, a recording of this presentation will be available on the Keen portal through the OKA website. So I'd encourage you to go back and review the presentation for any information or details that you may have missed. Yeah, once again, I thank you all for signing on and joining us tonight. And thank you again to our presenters. Have a great evening.
Thanks, everyone. Have a good evening.